Hi, this is Mikie Sherrill, and I'm here in Chatham with Amit Sikka at the Liberty Drug and Surgical Pharmacy, and we're here to talk about PBMs. Those are those somewhat mysterious middlemen that drive up your pharmaceutical prices, sometimes up to 10 times. So Amit, can you tell us a little bit about PBMs?
Sure. So what is a PBM? It's a pharmacy benefit manager. What do they do? That's a tricky question. I've been working in pharmacy for about 20 years and still don't have a great idea of what exactly they do. But basically, they're behind the scenes. Like you said, they're a little shadowy. They have three major focuses. So when we go to a doctor or a hospital, we have health insurance. That'll cover, our hospital visit, doctor's visit. And then on the other side, when you get a medication from your doctor, oftentimes we'll have a pharmacy benefit. The pharmacy benefit manager, they handle the pharmacy side. So what they're doing, basically, again, like we said, they're working with drug manufacturers for pricing. They are reimbursing the pharmacy for medications that we dispense. Oftentimes, it's at a lower cost to what we pay for the medication.
So you pay more for the medication than you get reimbursed
That's
for.
right. Yeah. More and more it's happening. And then the third side is you, the customer. They basically, one, will tell you if they're going to pay for the medication that your doctor is prescribing for you, and then the quantity that you can get, and the cost of the medication.
So some of that sounds fairly benign, and yet they're not really advocating, it sounds like, for patients. It sounds like they're really driving up costs, sometimes, like I've said, up to 10 times what people should be paying. How does that work?
Yeah, that's accurate. So PBMs themselves are owned by these big, giant conglomerates. So you have CVS Health, United Healthcare, and Cigna. So they own most of these PBMs. And
So
all
just three companies mostly.
Mostly these three companies, yeah. And then these companies, obviously they're all profit driven. So if we want to drive costs down, they want to increase their profits, so something's got to give. So in the end, two groups get squeezed. It's us, the independent pharmacy, and then also the customer who wants the medication.
How do PBMs drive up overall healthcare costs and drive up costs for consumers?
So when you fill a medication, sometimes these PBMs will have deals with pharmaceutical companies, and maybe they get a rebate, the PBMs, but basically what they want to do is dispense the brand name medications, which increase costs for the overall system, but it's going to increase costs for the customer as well. Their copays for brand name medications typically always higher than a generic medication. So that's a big way that they're actually adding costs to the system.
Well, Amit, thank you so much for walking us through this really complicated practice that's driving up so many costs. And that's why I'm here today, because as governor, I'm going to be totally focused on driving down costs for the people of New Jersey and certainly trying to fix our broken healthcare system. That's why I'm going to hold PBMs accountable for driving those cost savings towards consumers, not lining their own pockets, making sure they're not driving consumers towards those more expensive drugs that are really driving up their costs, and overall taking on the different practices and predatory practices across our state that are really rigging the system. So thank you all so much for taking the time to listen, and thanks, Amit. It's wonderful to be here at Liberty.
Thank you for coming.